Today we have to talk about labor. You know, after pregnancy, you definitely have to go through labor. And you know, labor, as the books always say, is just the expulsion of the fetus and then the placenta. So just the baby will come out and then you are done. But you know, as I always say, there are some signs you need to know that you are actually in labor. Some signs are not visible to others. You experience, some you just see. So there are, I would say, just few signs. As example, when you are pregnant, you see the show. The show is a very thick plug and it is bloody. So when you see that bloody show, then that will be a sign of labor. Sometimes it's reddish and then brownish in color. And then sometimes too, it's a bit deeper as well too. And then you also see something called the uterine contraction. You have a pain, very severe pain. The uterine contraction, it starts from the fundus, I would say the top of your abdomen. And then you have the abdomen becomes harder. Someone will say it becomes like a ball, very hard to the extent that you don't know what is happening, and then it relaxes. That is the uterine contraction. Then another thing is you also have severe pain, the lower abdominal pain, and then the waist pain as well. And then sometimes your water can break. As I always say, can break. It is not all the time your water breaks when you are not in labor. Sometimes when you are not in labor, the water can break. Sometimes when you are in labor, it can break over or the midwives who is actually doing the delivery will have to break the water for you. So that one, if your water breaks, you have to come to the hospital immediately. Because when the water breaks, sometimes some people will say, some pregnant women will say, my water has broken, but I have to wait a little while and wait for the pain. But I always advise my clients that when your water breaks, you have to come to the hospital immediately, because when the water breaks, you are exposed to infections. So when your water breaks, the infections that you have been exposed will be treated when you come to the hospital. So actually, these are the signs that you will see when you are in labor. The other ones, I always say, misconceptions from other places. Some will say they vomit a lot. They vomit a lot, but it also depends. You can also be having loose stools excessively sometimes too, but it is not part of what is in our books. But sometimes some women go through it. So I would say we have stages of labor. Stages of labor, you know, just like when you go to university, you are in level 100, level 200.
Okay.
If you are supposed to finish with level 400, then you are done. So it's just the same as in labor. Because when you start stage 1, you go to stage 2, before you get to stage 3, then stage 4. Then you are done with labor. The most painful one is the stage 1. Because that is where there's something we call more pain, more uterine contraction. And then you get through, and then there's something called the cervical cervix. You know, the cervix has to open. It is something called the neck of the womb. So the cervix opens, and then the baby will come out, and then you will see the baby at the vagina. So the cervix is actually inside, so it's not outside. So it has to open from 1 to 10. And how to know that is only being done by the midwives or the gynecologist. They have to do something called the vaginal examination to be sure where you are actually, your cervix is. So sometimes when you come and then you are about
do they open naturally or?
Yes. When you are in pain, when your pain starts, when your uterine contraction, labor pain starts, then it also tries to dilate, or it opens. I'm using my term so much. It opens up and then the baby will come out. So it actually starts from 1. Especially when you haven't delivered before. Let me say those who are delivering for the first time mothers. It takes a while. Sometimes from 16 hours to 17 hours.
Wow.
Yes, but and then not that you have to go through pain from that time to, you know, when you get to certain hours, definitely the pain should increase.
Okay.
That is when you get to the second stage.
Okay.
For the second stage, when you get there, the pain is unstoppable.
Wow.
Yes, you have to get there. That is where the service opens to 10. That is fully dilated. It is actually well open, where the baby ready to receive our baby.
Okay.
So all we do is to encourage the mothers. That is where the fathers have to come.
And at that moment, let's have a bit feel when the service is being opened from 1 stage 1 to 10. The pain the woman goes through. You know, what are some of the actions? What are some of the scenes?
Some scream.
They
like screaming a lot.
Why?
Because
what sound did they produce in screaming? What did they say?
You know, some even insult their husbands as well too. They insult their husbands a lot. Sometimes it depends on how or the treatment they have been given by their husbands. That is where they come out and pour everything out.
Oh, so the pain happened. That's what. Look at your big head. Look at his face. Look at this ugly man.
Yes, they keep on insulting the man.
Can you recollect some of things? What they say at all?
Let's say when you come to a set in Ghana,
your big head.
Your big head.
So they'll mention your name.
Yes.
Okay.
Kofi Papa
Kofi's dad. Your big head. Your big head.
Yes.
Oh.
And then you have made me go through so much pain.
Oh my goodness.
and oh my man, that you don't let me sleep at night. And look at the condition you have even made me.
Oh my goodness, I'm even crying.
But that's why I'm saying that's where the husband has to be, relaxed. Like, hey, you don't have to be. I know one client who was just squeezing the man's hand very hard.
So suppose he held the something. The man would have been dead by now. Because, or you can't imagine.
I know, I've not seen that before anyway.
Because the men are smart to position, you know,
themselves.
For their hands to be held.
Normally, it's their hand. They will squeeze you and then they may be beating them. Yes, some beat the men.
Because of the pain.
Because of the pain. The pain is so unbearable. It is not easy. But, you know, depending on how everybody pain threshold hits.
On the lighter side,
yes.
Has somebody called the name of the ex-boyfriend or ex before you realize you are mentioning things that you are not supposed to?
I haven't heard, but maybe it can happen.
It's possible.
It is a possibility. It can happen that ex-husband or ex-boyfriend.
Yes,
they can mention
his name could be mentioned. Oh, I see.
But that one would be, it will be awkward.
Yeah, because, because pain can bring out more stuff.
It can bring a lot of other
on the lighter side, ladies and gentlemen.
So this is just, the stages. I talked about the stages and then what. So when you get to, when the service is actually fully dilated or open, it depends on the position you want.
Okay.
In Ghana, some are being put on the, you lie at your back, but some do something called the squatting.
Okay.
That is when you have to push your baby out.
Oh, so you squat.
You can
would
do
there
squat.
Be something?
Yes, there's something. There's I said a chair. It's like a round chair where the woman can sit on.
Okay.
And then they support the baby down to receive the baby.
Okay.
Or you can do what we call the it's a very big word. It's called the lithotomy position.
Okay,
that
lithotomy
position. Where you are, your head, you lie at your back. Okay. With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the legs so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position where you are, your head, you lie at your back. Okay. With your legs flexed. So your legs are being, stands down. Oh. And then sometimes we can position the legs so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position where you are, your head, you lie at your back. Okay. With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the leg so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position. Where you are, your head, you lie at your back.
Okay.
With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the leg so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position. Where you are, your head, you lie at your back.
Okay.
With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the leg so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position. Where you are, your head, you lie at your back.
Okay.
With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the leg so that, because when you get to that position, do what we call the, it's a very big word. It's called the lithotomy position.
Okay, lithotomy
position. Where you are, your head, you lie at your back.
Okay.
With your legs flexed. So your legs are being, stands down.
Oh.
And then sometimes we can position the legs so that, because when you get to that position, some women even throw their legs.
They throw it.
Yeah, I mean, when assuming they are pushing and then their pain is so much.
Oh, okay. They
even hit you with their legs. Sometimes, so we have to, how should I say, tie them. But it's not something like that. But that bed has a leg where you can put your leg on and then you push.
Okay.
And then when you are pushing, the pushing is a problem, especially when somebody is a first-time mother.
Okay.
When they have to, the thing is, when you need to push, it's just like a constipated stool where you have to bring it out. Nobody teaches you how to do that. When you get to the washroom and you want to push or you want to bear down,
right?
You need to bring the out. It's the same as when you want to push your baby out.
Okay, so naturally that's happened.
Yes, and then that is when you have your contraction.
So let's see that. So we are talking about
pushing your baby out.
Okay, that thing.
When you do that, that's making that sound means that you are rather pushing from the throat.
Oh. So what? Tell me.
Some give so many. That is not pushing.
Oh, I see.
Well, that means that the pushing actually is not affecting the baby to come out.
Oh.
So you have to push. Some make that noise, but we always tell them, when you are pushing, we can see the baby. When you are pushing, we actually know you are pushing. But when you are not pushing, we know you are not doing anything.
And I've been told that's why maybe you, the nurses, will kind of beat the woman. Come on, push and let's go and stop what you do.
You know what? Beating the woman is an issue. Some women, they always say they want to be beaten. Yes. They want to be beaten before, they want to have a feel about how it is before they can push.
Wow.
That is what some people say, but it's not all the time. But, the woman is actually in pain. Why do you have to be beating the woman? Push your baby out. I mean, it's all about encouragement, how you talk to the woman. When you talk to your woman very politely, when you get to a stage, some midwives get angry because, when the baby comes out not alive, then the woman will have to be the midwife or the one taking care of you will have to answer for that. Okay. Why the baby didn't survive or why the mother too didn't survive. So sometimes, that's what I'm saying, sometimes they actually just beat the woman, not like beating the woman, but just
but something to put you to execute.
Even though, in the outside world, I mean, in the UK, they don't do that. And it's actually not, advisable to do that. You just have to encourage the woman to push the baby
and sometimes
out.
you encourage, you are not encouraging, and you are compelled. Is that not correct? Anyway,
yes,
that was it. Yeah. All right. So having gone through the process, the service being open from 1 to 10, now we could see the head of the baby coming up. So what would be the duty to perform at that moment? Your hands
as I said, your hands, I mean, it's not an empty hands anyway. So you have to put on the gloves, a sterile gloves, and then your gown. We normally put on a gown, so that in case there wouldn't be any infection. Yes. So you put on the gown, and then you put on your sterile glove, and then you encourage something we call, you have to guide the perineum. The perineum is down. You know, if you don't encourage the woman and you don't guide the perineum, sometimes there's something called the woman can tear a very big tear sometimes to the anus.
Especially when the head is big, like my head, right?
Your head is big.
Yes, my head is big anyway.
No, but it wasn't like this when you were a baby. Anyway. So as I say, you know, the cervix is such a way that it expands. You know, the vagina expands. Sometimes they get to a stage whereby the head is stuck there. That is where we have to do something called the episiotomy. We have to cut. We just make an incision so that we just pave way for the baby's head to come out. That if you know, you don't feel the pain when we are cutting, because we have to give an anesthesia at the joint or the end before we cut. And then when we cut, then the baby's head come out. And then when we are done, then we just have to suture it back when baby is okay, and then the placenta is out. So you know what I talked about from the beginning was the first stage. So the second stage is when the baby is coming out. So the second stage, when baby comes out, then baby is alive, and then we always, some women will say, oh, beat my baby a little bit so that baby will cry. Yes, I mean, we need the cry more than ever. You know, the cry, when the baby cries, when they come to the world, they have to get, that's the first air. I would say the first air they will have to get to their lungs. So when they cry, then the lungs expand. And then the lungs start working. And the baby starts crying again. But when the baby doesn't cry, that is where we have to stimulate the baby a little bit to cry, so that the baby get the first cry, so that there's life. Yes, the lung starts working. The baby coming out when it's important thing to, yes, very important. And then it's, you know, when the baby comes out and it cries, the mommy is also feel at ease, like my baby is fine. Life. And then baby isn't dead. Baby, when you know, when the air gets in, then the color of the baby starts changing. Yes. When they come out, their color is different. What color is that? Like bluish color. Means that there is no oxygen flowing through. So when the oxygen, you can see that? Yeah, you can see it. Baby becomes white, or let's say it becomes bluish. So when they cry and then the oxygen gets into the lungs, and that is where the color changes to pink, which is perfect. And then the baby starts breathing and then crying, and then you just have to cover the baby with a towel. There's a warm towel, and then you put it on the baby mother's abdomen. Hold on there. Now the baby is out. Yes. You mentioned something, placenta or something. What is the third stage. The third stage. Okay, yes, let's move on. So baby, you put the baby on the mother's abdomen. That will provide warmth and then bonding between the mother and the baby. So I know in other places they don't actually, when the baby comes out, then we give something we call the oxytocin injection. You know, we produce oxytocin naturally, but we just have to give it out, let's say the artificial oxytocin injection, and then we have to examine and see if, you know, there are second twin that might be coming. So after the first baby had come out, if they are twins, you have to examine if there's a second baby coming or not before you can give the injection. But if there's a second baby coming, you need not to give that injection. Otherwise, the cervix or the neck of the womb closes. So suppose you are not aware during pregnancy, where they go for scanning and they are told maybe you have twins. Jude, I haven't, you definitely, you know, every midwife needs to go through the client's book. Let me say the antenatal book or the file or the folder to be sure about the type of baby the mother is going to deliver. It can be 3, It can be 2.
And it can be male or female?
Yes, it can be male or female.
Okay.
So if you don't go through the book, then you may not know.
Okay.
So I would say the negligence can also happen in that, which shouldn't happen.
Okay.
You have to go through the book and make sure it is a single baby or it's a double baby before you can go ahead.
Okay.
But you know, some will say scans cannot be actually trusted. Yeah.
Okay. So you have to give, as a midwife, give yourself a time.
Yes.
If there will be a second
second baby coming,
a second child coming. Okay.
So when the baby is out, then if you check there's no second baby, you just give the oxytocin and then you deliver your placenta, which is the 3rd stage.
Okay.
You know, as I said before, the placenta was already there, protecting the baby, giving the baby, nourishing the baby with, let's say, blood. And then
the placenta, is that kind of a thread or line,
that thread you are talking about?
Or like, it looks like an intestine.
You said it looks like an intestine. Yeah, that is the cord.
Okay, the cord.
Which is connected to the placenta and the mother.
Okay.
So actually the placenta is attached to the mother in the womb, in the mother's womb.
Okay.
So when the baby comes out alive, then you hold let's say the cord, so that you can bring out that big thing out. It's a very big, it's a round thing. It has a lot of veins around it. In tree they will say a tradie.
Okay.
Then when it comes, you have to try and then deliver it slowly. Some do it vigorously, but when you do that, you know, the placenta, when it's been attached to the woman, it has a lot of, I would say, cotyledons. It's a big toss.
That word. Cotyledon.
Oh, please.
My goodness. Oh, so
I would say it has a lot of.
It's something part of the women. We thought the men because.
Oh, please.
Okay.
It's not what you are thinking about.
Anyway.
So when you deliver the placenta safely, and then you bring all blood, I would say there are a lot of blood, and then the placenta has the membranes as well too. So you have to take all the membranes out and it's attached to the placenta. So sometimes some might get stuck in the womb, but you have to try and then take it out. Otherwise, the mother can bleed a lot.
Wow.
So after that, you clean the woman, make the woman comfortable. And then you still have to thank the woman anyway, because it is not easy. No matter what they did.
So in all this process, would the husband, or is the husband supposed to be there?
Yes, please.
The husband is supposed to be there?
Yes. Normally, I advise them, the males. So that's why I said male involvement. They have to be there. And then I once, in one private hospital which I worked, where the man needed to be around. And then he also wanted to be involved in the activities that is going on in the room. So what we actually did was, we actually made him to cut the placenta. So the cord there. So when the cord comes out, we have to separate the mother from
the child.
Yes. So there's something we call, you have to cut the placenta. There's not the placenta, the cord. So the man held the scissors, and then he was very happy that yes,
he did that like a ceremonial thing.
Yes. You know, in this the white, that's what they told you. Yes, they just have to, that they are also involved in this whole situation. So they have to be. But I have to ask, some men are afraid, very scared,
and emotional,
and so emotional. But I have to, when they come in the labor ward, I always ask them, are you sure you are comfortable? Will you be able to stand? Are you sure? Because I have witnessed one. No, dude, I have witnessed one before where the man almost fainted.
Why?
When the baby's head came out, the man was said, "Auntie, what is this? I'm seeing something black. I can't see it well." Then all of a sudden he told me he can't see. He was getting blind. And I said, "Are you sure you're okay?" Said yes. Then all of a sudden I saw him going down.
What?
Then I told him to sit down and relax.
Wow.
Some of them, I just tell them to wait outside. And then when we are done.
That's a serious thing.
It's very serious. That's what I'm saying. It's a courageous man. It's not a courageous man to be able to stand.
Women go through a lot.
Yes.
And not to be respected.
Yeah, you have to.
Wow.
It's very, very important.
Wow.
So men should respect their, the men.
Okay, so suppose the husband is not around at the time of labor.
At the time of labor.
When he's coming in, can you get something, to psychologically, put the woman in happy mode? So maybe you cook her favorite food, or you come in with, some flowers and stuff. Is that encouraged? Tell me.
When you get to that stage, you forget about everything.
Oh, the woman.
Yeah, the woman forgets about everything. Yes, they can still come with the flowers, yes, which is very nice. But, they will not even think about the flowers.
Oh.
It's the pain they are talking about. They are even thinking about the pain. Going through that stressful motion.
Oh, so there's nothing like happiness at that moment.
No. Oh. When the baby comes out successfully and baby is breathing, then the woman is, relaxed. And then one thing I always tell my clients is, this is the time. If you don't, no one can push the baby out for you.
Except you do.
Except you. So if you don't push your baby out, when the baby is stuck, the baby's head stuck in the vagina, it is very difficult. Their breathing comes down, their fetal heart drops. So, it's just like they are blocking the nostrils. They have to come out, and then we have to clean the nostrils, and then the mouth too, so that it paves way for air to, get in. But if their nose are blocked in there, baby can come out asphyxiated. But that's what I'm saying. When you get there, we have to encourage. So the
pushing has to be a continuous thing.
It has to be a continuous thing. When you are having a contraction, as I said, the uterine contraction. When the uterine contraction comes, and then the woman also adds up her pushing, that is where it is more easier. But when you wait for the contraction alone to come out, it will be a very difficult for the baby to come out.
We've just made almost 40 minutes of this interview. We'll be wrapping up very soon. Now, the baby is out. Everything, is almost ending.
Oh, yes.
The baby is wrapped, with the clothes.
Or the towel.
Does it happen where the mother fall asleep, moments when all those processes are going through and the baby is left in the hands of the nurse?
No.
The midwife.
The midwife. I will also say that it's not all the time. After delivery, we need to clean her up and then make her comfortable in the bed. But she can't just sleep whilst, she's in labor. And then after delivery, every woman wants to know that, yes, this is my baby or so. So I'm not sure they will sleep at that moment. So that I would say some negligence of some women can, or some midwives.
In a minute, can you tell us the possibility or the yes, let me say, those happenings, or, what could make one lose, his or a baby after being delivered? Like people go to labor and they are told, oh, they can't find their babies. Like, your baby is missing, your baby is dead. Fake, kind of.
Sometimes, yes, I would say it's a fake, and then some negligence in some parts of the nurses and the midwives as well. But all we actually do is when a baby is being born, we have to give them a name tag. Like there's something, a band we put on the rib, let's say the hand of the baby, so that we can identify the baby and the mother of that particular baby. So some, if there is it's not available, and then there are a lot of babies around, that is where they sometimes negligence, I would say, on
the part of who?
On the part
the midwife
of
or the
caregiver. It's not only midwives who actually do the deliveries anyway. So the gynecologists are also around. So I would say that the healthcare provider, sometimes some of the negligence they do. And then in Ghana, I heard it was going on, but now it looks like it's okay because some of the midwives, yes, were also trying to talk about they didn't have a lot of money, so they use that to
sell people's
to sell other babies to
make
other
money.
Mother, yes. Especially someone will just come and say, so I don't have a baby and I want you to get me a baby.
A baby.
And then
also they steal newborn babies for other parents or other
other parents, yes. But you know that one is very, very unlawful.
And then they do swapping and all that. So where would the parent or the mother of the child or the relative of this woman in labor, what would she be to an extent that she can't figure out all these?
But Jude, as I said, it's not actually there because immediately the baby is being born, we show the baby to the mother. Okay, this is your baby, so you will know this is your baby. So you know how the baby looks like. Even through cesarean section, baby, that's why the mother is not put to sleep during cesarean section, depending on the condition. Okay. So definitely, if it is not the mother, a relative should be around to identify the baby before they clean up and then put the baby to the ward. Okay. Okay. All right. I know we'll have more questions and more to know. We're not ending today. Oh, yes. Yeah, we shall continue and we'll bring you some other interesting topics that we ought to know. But that's what we have to end today because the NCCE are also in to educate us on child protection. Thank you. Okay. So Mrs. Annabelle Nusenu. Yes, please. Astute midwife. And like I said in the morning, if you're looking for, if you have been able to impregnate your wife, and you're looking forward for an assigned midwife to be taking schooling your wife through. Oh yes, yes. Hit us up. Yes, hit us up. We'll let you. We'll do that to assign. So mechanicry. So why you mo yere? Na say per se ye schooling ye den fan team na onye nim de fa ne period na owom no ho a available say ya be wow. No number ni is 0200194141. For YouSort for na asane we ne ma midwife. Yes. And I mean okay. That was it. No. Ofa na time mo ajobo no. Okay. You know. You yoga. Oh yes. Yoga feel. All right, your shout out. Okay, to my mother-in-law who is listening now. Auntie Teresa Nusenu, God bless you.